I'm here with Anand Haridas, a cardiologist at St. Mary Medical Center. He's been using the discharge instruction process for, what, a week now?
A few months now.
A few months now, okay. So could you talk about how it's been going for you?
I think it's good. I mean, I've gotten used to it now. I mean, I think initially it takes a long time to catch speed, but after you get used to it, it's rather quick. I think the good thing is people don't have to read my handwriting anymore. So that way patients go home with a printed instruction. And I've actually got feedback saying that they actually like that aspect, that it clearly states what to stop, what to start. And those are some good aspects of the discharge instructions.
Excellent. So you really feel like the paper process, this is an improvement over the paper process, although it's a pain to learn and
It is use. There is a learning curve, yes, but eventually I think it will catch on, and I foresee that happening. And I think overall, when it comes to patient care, it's a better option.
How many have you done, would you say, in the last week?
The last week, maybe about 4 or 5 discharges, probably.
And how many would you say it takes before you become proficient?
Well, I would say it takes about 5.
Okay.
Yeah, before you, I mean, the initial 5, you will make mistakes. And so that shouldn't be discouraging. In fact, you just have to kind of, as you go through the mistakes, you realize what you did wrong and you hopefully correct that. But you will make mistakes as you get along. So just don't get discouraged by that.
Dr. Haridas, thanks.
Thank you very much.
I'm here with Dr. Chris Bradley, a neurologist at St. Mary. How are you doing, Chris?
I'm doing fine. How are you?
How's the electronic discharge process going for you?
Actually, it's going smoother than I anticipated. Usually, for my service, discharges are done by nurse practitioners, but we have somebody on vacation right now, so I've been doing a fair bit of them recently, and it's actually surprisingly straightforward. So I've actually been pleasantly surprised.
How many would you say you've done in the last week?
About 6 or 7.
Okay. Do you feel like you're proficient in it now, or still learning, or?
I've almost got it.
Almost got it. Okay. Yeah, I've done about 100 of these, and I feel like I'm almost got it too. Thanks, Chris. I appreciate it. Have a good day.
Thank you.
I'm here sitting with Blanca Martir, one of our nurse practitioners on MS1A. Nice to see you, Blanca.
Nice to see you too.
We wanted to ask you about how the electronic discharge process is going for you.
It's been going well. I've been doing it ever since I've been trained. It has to be like, 3 months ago? And so I've kind of been using the system, and I've learned how to work on it on my own. I figured it out. If I just press the right button, I get the information that I need. And I think it's a very good tool for discharge planning.
I think it's really difficult to learn our Meditech process. How many discharges did it take before you really kind of started to feel comfortable?
It took me quite a few. I think the more you do it, the more you get comfortable with it, and then, as long as you know everything about your patient, what medication that they need to go home on, it shouldn't be difficult. When you have to upload their problem list, that's easily done. When you go on the summary section, and you can just throw all those admitting diagnoses right into there, or else you can just type them in yourself too. So it doesn't really take that long as you know that, all about your patient and what meds you want him to go home.
So you're saying that if you know what you have to do with the patient up front, the discharge process becomes a lot easier.
Exactly. For us who go around to each floor and see patients that we don't know anything about, it takes us a little time because we have to learn about the patient, talk to the attending, talk to the consults, find out what the plans are for discharge.
Excellent. Fantastic. Blanca, thank you so much for your time.
Have a good day.
Okay, bye-bye.
7782.
I'm here standing with Dr. Yusuf Khan,
Yes.
and we were just talking about your NP and how she's been doing with the discharge process.
The process is very time consuming. It takes really quite a bit of time to get used to doing the electronically. We have been using it on the paper and dictating it, which was really a simpler process. I did one under duress the other day, and it was really a painful process. But I think NP is getting better because I'm hoping that she's going to get more experience, and with time she'll get more.
Do you feel like she'll get better with it and the time will come down?
I'm hoping that it'll really it'll take her less time to complete the whole thing.
Have you spoken to some of the other NPs?
We need to have the whole thing in integration. CPOEs, electronic medical records, not just one thing in isolation. Because you really, if you want to go electronically, you really want to go full electronic and also having a iPad to the physician. So rather than signing on, signing off every time you see a patient, I think we need to go complete. I guess you're going electronic by 2014, right?
Oh, no. We're going June 5th. We're starting with CPOE.
Yeah, but
And actually, there are some options to move forward with physician documentation electronically as well,
Yeah,
which is going to be really exciting as well.
yeah, which is what we're starting.
Right.
Hopefully, we're starting soon in our office too. But I think it's time will tell how it works out.
Yeah, and we do have to take these steps, but the
This one.
CPOE is coming only a few months later.
It's coming
And
in July. I
in
believe.
July 5th, that's
Yeah,
right.
yeah,
And
yeah.
as you
I'm
said,
used to it. I worked at it at Capital Health, so I'm really quite facile with that.
excellent.
Yeah,
Good. So do
yeah.
you feel like the discharge process, even though it's more time consuming, is better for the patient?
It is, because you have more documentation, more instruction for the patients, more instruction for the nurses. When the patients comes to your office, everything is all, is legible, and it helps you out with the medications, So
Terrific.
I think in the long run, this is what the patient would need.
Hey, thanks, Dr. Khan.
Yeah, absolutely.
Have a good day.